Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to go through a case here on an adult lady who has a simple class 3 type malocclusion, and you will find these a good many people have this simple class 3, so they're touching edge to edge out here. And when they bite their front teeth together, the back teeth go together at the same time. They don't have any overjet and overbite. And so you can correct this. And she's got a crossbite up in the front part of the mouth, and also some tori in the inside. And the lady elected to do a genioplasty and bring her chin in later on after we had done this, but we'll show that picture also. So let's get started here, and this is, you'll run on a good many adults where their teeth are just ground in at a certain position, and you don't mess with them. You just deal with the front teeth up here, and we're doing that in this particular place in this case. Let me get it going here now. Here is the lady. And this is a picture after we started the case, and she's already got the tooth is out in this particular case, but I'll show it the other. Now here is the original anterior position of the teeth. She said end to end right in this area right here. Let me get this little pen going, and you can see we're just setting end to end. So when she bites off something up here, these teeth hit back here in the back, and that's not good. It's really better if you've got a little overjet where your upper front teeth are out here and your lower teeth are up here, and you reach out and bite on your lower teeth. You raise the jaw up back on the condyles, come out of the socket some, and it raises it up, and you can bite on your front teeth. And you can't do that when you've got this end-to-end bite like this. Everything's touching back here in the back. So now what you do on these cases is very simple. You just extract one of the centrals, the one that's furthest off. Now this central here, we're going to move it over, and it'll be sitting right in this area, right here in the center, and this will be touching this cuspid and everything. And so you just don't notice that she just has 3 lower centrals when you get through the case. And now in her case, we remove these tori that are inside, or we didn't do it, but the oral surgeons, they do a genioplasty too on her. She wanted to do that, and I'll show you. That's where they take the chin and go back, or you can bring it forward if you don't have a button down there and you want to need one. So this is 1985 when we start this adult, and this is where we'll show these are the tori that take up quite a bit of space in this part of the mouth, and that has kind of crowds the tongue out in other areas. It can create some problem. Now we're going to take this tooth out and pull this together, and that'll bring these teeth back so that these lower teeth will be underneath the upper teeth, and she can have a little overjet and overbite, and that allows you to bite your front teeth together without your back teeth hitting. And that's basically what you do on this type of case. It's really a simple class 3 correction. Just watch it as we go here. Now we've already done that, and this x-ray right here, you see her chin was out here somewhere, and they cut underneath here and brought this back. So we sent her into an oral surgeon, and they'll do the genioplasty. Just bring the lip back, and they'll take this off and go back and suture that up, make that where it grows back, and it straightens the facial structure out. On women, a lot of times, if they've got a real prominent chin, they just don't look real good, and so you can do that fairly easily. The oral surgeon. Well, there's the original chin, and this one here it's already moved back. Now you can see. All right, let's go ahead. Now she had one molar here that was had root canal, and I don't think it's a crown, but it's a big, huge filling and everything. So you're gonna get adults with all kinds of problems in there, and you can do a simple orthodontic thing where we give them a little overjet and overbite in there and get it where they can bite and chew like they normally would, and it just helps everything out. Now I'm going to go right on through this. It's not a difficult case at all, but here she is when we started. There it is when we finished up we put an upper retainer in there, and you see the lower teeth are inside the upper teeth right there. You can see that real good at that point. I'm going to show it a little closer as we get along here. Well, here you see it. All right, you see we got this cross bite in this area here, and everything on the sides are going to be pretty much the same. But you see this lateral is pulled out right here. These teeth are brought together here and brought them underneath, and you've only got 3 teeth, and one of them is right dead center, whereas the center line was over here. So we elected to take this tooth, and this one was already part of the way across there, so we just moved it in there like that. And then you've got this tooth. We bring this to where this lateral fills up this gap over on this side. This lateral plus half of this tooth, and the lateral plus half of this tooth, and it brought this underneath here, and so this is the midline after you get there. So you'll find quite a few adults that are that way. And then we took the chin back and made the profile better on this lady, and that may be something else you'd want to know. And so there it is up close. You can see what we did and what improvement it does. And on the sides, they're virtually the same, not exactly. And we didn't go into a lot of other problems in here, but we left them pretty much like they were to start with. And on the other side, a very similar thing, and they'll gradually close in here after she is out of the braces and everything. The teeth will come down and get what we call just socked in on each other. And let's go now to the life, and we put a little bite plate on our retainer so she bites in there, so you got just a little bit of overjet and overbite, and allows her to bite with her front teeth and her back teeth don't hit. And now the upper, you don't see much difference in it. The lower, you see where these tori were right here is gone now. So the old surgeon took those out while he was doing the genioplasty in this area. So this is adult orthodontics, and this is what I've been trying to put across. We need the university trained, or the orthodontists that are trained and put their shield up. I mean, they are supposed to do this adult orthodontics, and a lot of these people do not get into adult orthodontics at all. It's just a world of it is not being treated. So thank you a lot for watching, and I'm going to sign out. I hope you'll join our group, and if you want to start learning orthodontics, go to the American Orthodontic Society. We have our headquarters in Grapevine, Texas, and it's just a few minutes from the airport out there, and there's 5 hotels right close to our center where we'll be teaching people orthodontics. So thank you for watching, and I hope you get something out of this. I won't say goodbye.